Welcome everyone to the latest installment of the Research into Action webinar series. I'm Nicole Elguero, an analyst on CADCA's evaluation research team. The purpose of this webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition fields. In today's webinar, we're privileged to have Dr. Nguyen join us for a presentation on her recent research article, Associations Between Tobacco and Cannabis Use and Anxiety and Depression Among Adults in the United States, findings from the COVID-19 Citizens Science Study, published in PLOS One in September of 2023. Dr. Nguyen is a behavioral scientist and an assistant professor of medicine at the University of California, San Francisco. Her research program focuses on substance use and related health disparities among priority populations like youth and young adults, sexual minorities, and people with substance use disorders. Dr. Nguyen founded and leads the smartphone-based research lab on tobacco and substance use for health equity named Hardy Lab. Her team has employed cutting-edge research methods to provide actionable insights and develop novel interventions to reduce substance use, promote public well-being, and advance health equity. Dr. Nguyen has received funding from California Tobacco-Related Disease Research Program and the National Institute on Drug Abuse. Currently, she is a principal investigator on two projects that harness mobile health technology and machine learning to investigate predictors of tobacco and cannabis vaping behaviors and to develop smartphone-based interventions to reduce the co-use of these substances among young adults. I will now turn it over to Dr. Nguyen.
Thank you, Nicole. And hi, everyone. It's my pleasure to share with you my research today. Today, I would like to share with you about my research about co-use of tobacco and cannabis and mental health. And before going into the detail, I would like to shout out to my mentor, collaborators, and colleagues at UCSF Center for Tobacco Control Research and Education, and also at the Hardy Lab. And I would also to thank all my funding resources who support for my research, and I declare I have no conflict of interest. So here's the outline of my talk today. It will include three parts. The first part will be the overview of co-use of tobacco and cannabis. The second part will be the association between co-use of tobacco and cannabis and mental health. And the last part, I will discuss about the implication for prevention and treatment. So let's go to about the overview of co-use of tobacco and cannabis. We'll give you the very brief and high-level detail of what we mean about co-use of tobacco and cannabis. Up to the statistic, for the national statistic, around 22% of US adults report using any type of tobacco. It's not only limited to the cigarette, but also any other type of nicotine products. And also about 12% using cannabis in the past month. However, people who use tobacco more likely also use cannabis. And in my research among young populations, we found that young adults who use tobacco, they around double to 6 times more likely also report using cannabis. For the national data, we found that almost half of young adults aged 18 to 24 years old, they report using both tobacco and cannabis in the past month. And also 28% of US adults who 25 years or older who use tobacco also use cannabis in the past month. So here's we saw that co-use so common, so prevalent, and we cannot address only tobacco use or only cannabis use because we will miss opportunities to address the polysubstance use among adults and adolescents too. And in our recent research, our lab member found that co-use is more common than cannabis use alone among US adolescents. And this about the same prevalent of tobacco use alone. But more importantly, when people using two substances together, they are exposed to the more toxicant from both tobacco and cannabis, and also they have the may result to the more health risks that's coming from the two substances. So clearly, we need to address this issue. It's a significant public health issue. And we put it in the context of the increasing legalization of cannabis right now. More and more states legalize the recreational use of cannabis. So we expect that cannabis use will increase, and it may have some spillover effect on the co-use of tobacco and cannabis. But what we mean about co-use? Let's take the step back to really come back to the basic question. What I mean about co-use? If you get into the literature, the scientific literature, people normally refer co-use use any type of tobacco and cannabis in the past month. That's the common definition of co-use in the scientific paper. However, our recent publications does not focus on today, but it's necessary to provide you the context of co-use for you to get a better nuances understanding what the co-use means. We really dig into the detailed pattern of tobacco and cannabis co-use. For example, if we think co-use in terms of product combinations, people can use a different type of combination between the tobacco product listed in the left of this slide with the any type cannabis product in the right slide. However, I try to characterize this product in terms of mode of the administration, and you can figure it out, right? It's a twin product. If the tobacco have the combustible or smoking product, so cannabis. They have the cannabis joints, bongs that they can smoke cannabis. If the tobacco company produce the electronic device to heat nicotine oil like e-cigarette, so cannabis industry, they have the other type of similar electric device to use cannabis product. And also we have the smokeless tobacco that people put into their mouths, and cannabis have the cookies, tea, candy, that also have the oral ingestion product. So these twin or similar product really facilitates the co-use of two substances. And our own research showing that when people use one mode of the product, they're more likely to use the similar mode of product for cannabis too. So that's another point when we think about co-use, that in terms of product. However, we need to think about the more nuances, more level of the co-use. And I just give you an example of my research. Like 4 years ago, that we used the survey data from 3 schools in California among about 5,000 youth aged 15 to 22 years old. And we found that the use of cannabis among tobacco users is very prevalent. It's about 76% of youth who use tobacco reported using cannabis in the past month. And the most common product that they use is a combustible cannabis, followed by blunt, vape cannabis, and then edible cannabis. However, another point I want to bring up here is that the co-use prevalence is around 7 or 11%, right? It's higher than use of tobacco alone. So really, we need to take into account cannabis when we want to address the tobacco use among young people. Another complexity of co-use is the timing. What we mean about timing of co-use? It can be people use cannabis and tobacco at the same time, or we call it same occasions. But during at the same time, they can use in the same product, such as they roll out cannabis and tobacco into the slip and then smoke it, or blunt, they grab cannabis flower in the cigar wrapper and then smoke it. That they call it simultaneous co-use or co-administration co-use. They can use both tobacco and cannabis at the same time, but by different products. For example, they smoke cannabis joint first and then smoke cigarette right after the cannabis joints, and people call it chasing. In the scientific term, we call it sequential co-use. Another type of timing is that people use tobacco and cannabis in the different time. That can be different time within the day. For example, they smoke tobacco in the morning and they smoke cannabis in the evening. Or they can use within the same month. Like weekday, they use tobacco, they use cannabis during the weekend. And here is what the current literature focus about, like co-use in the different occasion within the same month or same day. Thus, they can combine any different type of tobacco and cannabis product list here. So co-use really complex behavior because it's integrated the two behavior of tobacco use and cannabis use together. Here's some example from my own research interview with the real participant who describe how they co-smoking. It means they smoke both tobacco and cannabis. This participant said that most of the time when I'm smoking marijuana, I would still smoke a cigarette directly after. Then I just started, for some reason, picking up the habit of like, I was already smoking a cigarette and I decided to run to a joint. So it would be kind of like that. And I gotten into the habit of liking both. Another example, a participant described about how they go vaping tobacco and cannabis. So all I have to do is unscrew my vape cartridge, or it means nicotine vaping, and then screw on the hash cartridge, which is cannabis vaping, and then use it right there. So that's the behavior, how they co-use via the vaporized product. And surprisingly, my colleagues at UCSF Center for Tobacco Control and Research Education, they found the similarity between the tobacco or e-cigarette and then cannabis product, and also the different type of cartoon, toys, or school supply that the industry tries to mimic to hook the kids on this type of vaporized product. For example, this one is a tobacco product, and here's a cannabis product, and this cartoon character that they try to mimic to hook the kid. It can also like food product here. That look e-cigarette look the same, cannabis look kind of similar. Toy, school supply. It's very surprisingly, but also very concerning because kids who very at the early age, like 13 to 18 years old, how they can differentiate what the difference between cartoon toys and then the substance use here. I'm not really mentioning about the hundreds or thousands of flavors they put inside this product to really make it mimic like the candy fruit flavor, which like create the huge epidemic of the vaping among youth and young adults currently. So all of this overview try to bring up the point that we really need to address the co-use of tobacco and cannabis together, not only single substance use, because we have the two big elephants in the room. And this elephant hand in hand together, we cannot separate it out. So now you already know about what we mean about co-use. We go to our focus of my talk today about what's the mental health effect of co-use. And here's a main paper we will discuss in our seminar today. It's about association between tobacco and cannabis use and anxiety and depressions among adults in the United States. This paper published last year. So we know that co-use can result into the concerning health consequences. Previous studies showing that co-use expose people to the higher chance to getting respiratory diseases and also other type of health consequences. However, when the pandemic came, with all of the stressor and then the social isolations, people starting talking about mental health. And this pandemic really underscore the need to understand about the use of tobacco and cannabis and the mental health. In the literature, we learn about a lot of papers documented that use either tobacco or cannabis related to the poor mental health. However, very little documented about how about co-use, when people using both substances, how the mental health effect would look like. And it inspired me and my team to answer the research question. Whether people who use both substances or co-use more or less likely report the mental health problem compared with people who use nothing and who use either tobacco or cannabis. So to answer this question, we use the data from very large cohort study. It's named COVID Citizen Study. It's conducted during the pandemic, during the 2020 to 2022. So quite recent data. And the sample size include almost 54,000 US adults nationwide, not only in California. Even this study conducted at UCSF. And we measure at baseline the tobacco use, like cigarette, e-cigarette, other type tobacco or nicotine product. For cannabis, we ask participants whether they use any type combustible or smoking and vaporized cannabis product. Other type of information we collect from participants is that like their demographics, social status, alcohol use, and physical activities. And we put all of these information into the model to modeling the association between the different pattern of substance use and the outcome, the mental health outcome. So basically, we divide participants into 4 exclusive groups. People who use both tobacco and cannabis, people who use only tobacco, people who use only cannabis but not tobacco, and people who didn't use tobacco or cannabis at all. And we measure how these type of patterns linked to anxiety and depression, which we measure by the validated questionnaire. People usually, you can see in the questionnaire when you have the checkup, is a validated questionnaire for clinical screening for anxiety and depression. And here's what we found. First, for the study sample, I would like to remind you of this sample is quite older adult with the mean age around 50 years old. Most likely female. Yes, because female, we found that female more likely to engage into the digital research more than male. Most likely heterosexual people, white. We have very little proportion of other race and ethnicity, and most likely quite high education attainment. So this use pattern of tobacco and cannabis different from the other statistic I mentioned early in this presentation, which more likely among younger samples. So for this type of sample, tobacco only is 5%, cannabis only 7%, and co-use 2%. Now let's look at the pattern of anxiety and depression by the 4 patterns of tobacco and cannabis use. Among people who not use tobacco and cannabis, 10.6% reported anxiety. 11.2% reported depression symptoms. Among people who use tobacco only, it's 19% for anxiety, 22% for depression. Among cannabis only people, 20%, 21% for anxiety and depression. And the highest prevalence fall into the group of co-use, people who use both tobacco and cannabis. More than a quarter of this group report anxiety and depressions. So based on this very basic graph, you can see that there's something happened here, and co-use really concerning because the highest proportion of anxiety and depression among this group. And our concerns confirmed in the modeling result. When we compare this group together to see how the likelihood of having anxiety disorder here. So this gives you very basic thing to interpret this result. Here's the odds ratio from the multivariate regression model. And if the adjusted odds ratio larger than 1, it means the compared group have the higher likelihood of having anxiety disorder. So by looking at this graph, you can see that, for example, co-use compared with non-use almost double the odds or the likelihood or the chance of having anxiety disorder. Similarly, co-use also have the higher likelihood to having anxiety compared with tobacco only use. However, the co-use and cannabis only use comparison is not statistically significant because this confidence interval crossed the borderline 1, even though we have the magnitude of effect is still higher than 1. It could be based on due to our sample characteristic who have very high proportion of cannabis only use is 7% of people who only use cannabis. And then when we compare cannabis only with non-use, is higher. Tobacco only with non-use is higher. And also people who use only cannabis have a higher likelihood to having anxiety disorder compared with people who use tobacco only. So that's all of the pairwise comparisons. And for the depression, in the first paragraph, first slide, I show you the result anxiety. And now for the depression, we found the quite similar result, right? And co-use compared with non-use 1.8 times higher to have a chance of having depression. Co-use compared with tobacco only 1.22. Again, co-use and cannabis only is not statistically significant because it's crossed the line here. However, when compared cannabis only with non-use, people who use cannabis only also have a higher likelihood to having depression. Tobacco only too. Cannabis also higher likelihood to have the depression compared with tobacco only. So this gives you some ideas of that when people use even only one substances, their chance to having anxiety, depression is higher compared with people who don't use these substances at all. And then when they use both substances, their chance almost double to having anxiety and disorder if they use non-substances or if they use single substances. So that's what the result, the key result from this paper try to tell. And here's the example when people use tobacco and cannabis together to cope with the anxiety and stressful daily event. When we interview with participants, one of them described that smoking cigarettes at a work break was almost like a meditation for me. just like a moment of solitude where I could not have to talk for 10 minutes. There have been high CBD or low THC vaping product, which is cannabis product, that I use have helped my anxiety. So here's a description how people explain why they use both tobacco and cannabis to alternatively to cope with their stress and anxiety during the day. You can read more about that in our paper. I put it here, where I put more context on more quotation from participants about the reason why they use both tobacco and cannabis. So let's try to like tie things up together what we have discussed so far. The key findings from this paper is that when people use both tobacco and cannabis, it's linked to the higher odds or higher likelihood of having anxiety and depression. However, I would like to be careful when trying to interpret the result from this paper, because again, this paper is a cross-sectional survey. When we ask participants, how you feeling, what you're using. So we collect data at the same time for tobacco and cannabis and the mental health. So we cannot strongly determine whether use of tobacco and cannabis actually the cause to anxiety or depression, or the other way around, like whether anxiety and depression may cause the use of tobacco and cannabis. That's what we need the longitudinal follow-up study to really confirm that causal relationship. But when we look back in the extant literature, we found the mixed evidence about the bidirectional relationship that requires other study or research showing that this relationship is bidirectional either way. And it's kind of the loop, because when people feel stress and anxiety and depression, they use substances like tobacco and cannabis to cope with that symptoms. On the other hand, the more they use tobacco and cannabis, the worsens the anxiety and depression and mental health became. So the bidirectional relationship is supported by not only our research, but also the extant research evidence in the literature right now to make it very clear. Regardless what the direction is a clearly need for us to really help people who use both tobacco and cannabis by give them and provide them the mental health support, because it's a clearly need that's not really addressed fully right now in the current treatment. And this study got the attention from 49 media outlets. That I give you some of example here that you can look and see how they wrote about our paper. So it feels like, oh, this paper really addressed the gaps, the attention or the interest of the general public that people really care about use of tobacco and cannabis and about mental health. So we got a lot of interview from the media outlets that they feature our study here. So this is very important. What does it mean? What we all talking about? Okay, we know that co-use linked to more mental health problems. So what? What's the implication for prevention and treatment to address these significant public health issues? I just listed very simple and basic implications that we can continue working on to address this issue. I think first of all, we need to raise awareness of the risk of mental health disorder associated with the co-use of tobacco and cannabis. And this awareness not only focus on the general public, but also about the communities we are living in, and also the healthcare provider, so they don't overlook when they screening for the mental health, they should also screening for use of tobacco and cannabis and vice versa, because it's a linkage together. It's so closely connected, interconnected to each other that we cannot ignore one of the other. Another point is that we need to correct the public misperception of harm toward using tobacco and cannabis, especially the cannabis. Currently, we saw some signal of decrease on harm perceptions toward cannabis. The legalization of cannabis make people may think that, oh, cannabis is not harmful. But actually, we don't have enough evidence to support any medical benefit from cannabis use. Research still going on to testing all of this. People use cannabis to deal with anxiety, depression, sleep, and pain without strong evidence to support for all of this. But using tobacco and cannabis in the long time can exacerbate the mental health issue, actually. When people use tobacco and cannabis to try to deal with the stress and anxiety, it can give them some quick fix or the bandage, but it's not really fix or treat the mental health conditions. So we need to correct that misperception via the public health campaign, educational material. That's we need to spread out the information to have the public understand that. Also important, that's a policy. We need to advocate for policy that integrate the mental health service with the substance use prevention and treatment programs. I saw a lot of you here today, right? Working in the prevention, substance use prevention or treatment program. I'm so happy to know it, because I hope we can work together to advocate for this policy to really integrate mental health service and substance use program together. For example, like do some routine screening for mental health and substance use and refer them to treatment. And also integrate re-engineering the treatment approach right now to integrate the treatment approach for co-use of tobacco and cannabis and mental health. For example, when we provide smoking cessation for people, we can add some support for mental health, right? To like really address this. And it actually helps to prevent relapse, because stress and anxiety and depression actually the strong reason why people relapse back to the tobacco or cannabis. And last but not least, right, we need resources to do all of this work. We need to increase and prioritize resources for people who use both tobacco and cannabis to address the comorbidity of the co-use and the mental health. So to tie up everything, this slide is a summary of all the points I was talking so far. First, co-use of tobacco and cannabis is common, it's prevalent. And it's not only like using tobacco and cannabis together. It's more like that. It includes the variety of combination of different products and the timing of using this product. Our research shows that co-use associated with the higher likelihood of mental health problems compared with people who don't use these substances or who use only one substances. And last but not least, based on this, the research, right? This webinar, research to action. What's our action? We can do some of the things. We can do the campaigns to increase the harm perception toward the use of tobacco and cannabis and co-use of both substances. We can integrate treatment for co-cessation for tobacco and cannabis and mental health to address this linkage. So this is component of the comprehensive package treatment. And the last point I want to make is that people who use tobacco and cannabis more likely have the low socioeconomic status. So if we can address the co-use of tobacco and cannabis, we really can advance the health equity. And we really care about not only physical health, but also mental well-being of our society. And it's very, very important. Yeah. Thank you for your listening. And if you want to learn more about our lab current work, you're welcome to check our website. It's Hearty Lab website. That's we have the mission to advance health equity for everyone through mobile health. And now we are doing developing different type of intervention to target the co-use of tobacco and cannabis among young people, because young people is a point we can prevent the later on of addiction and progression to the long-term health risk. I will stop sharing here and let Nikon take it over. Thank you.
Thank you, Dr. Nguyen. That was wonderful presentation. I really liked how you broke things down, especially for some of us who need some help learning, some terms, the scientific term versus the term in plain language. So thank you for your time and your sharing your expertise. But we'll start the Q&A session now. I will start with a few questions of my own, and then we'll hear from participants. So you mentioned that unprecedented stress, economic hardship, lockdowns, and social isolation early in the pandemic could contribute to the research findings. Do you have any plans to continue this research post-pandemic?
That's a great question. And the quick answer is that yes, of course, because as I mentioned again and again, it's so important. We cannot ignore the mental health and the co-use of tobacco and cannabis and cannot separate it. The main point here is that the pandemic is only the wake-up call for us. Wake up, that's a problem. That's a two elephant in the room. And it led me to see it more clearly. And now I lean toward to it to really address and integrate the mental health support into the co-use intervention for youth and young adult right now. And after the pandemic, people start talking more about mental health, which I think is really important and we overlook before the pandemic. And now people care a lot about mental health. We can start seeing a lot of resilience about mindfulness practice, meditation to help people to have the mental well-being. That we will need to continue to do more follow-up research and intervention. And actually, it can provide more insight to compare during the pandemic and post the pandemic, whether these associations are still the same or how it changed over time. So yes, we definitely need to do it.
And I know you mentioned that your findings have been featured in different news outlets, but who else have you presented your findings to, and who do you want to reach?
Yes, that's the point. It's my passion. When as a researcher, right? When you wrote the paper, you do the research. The first thing is I need to write as a paper, present at the scientific conference. That's what I did. But I feel like it's limited, the impact of this research. I only can reach the people like me who do research. But for people who really do the real action for the community, I haven't reached yet until today, right? Until today, I'm so grateful to get invited to this webinar because I can spread out that research out there to give the coalition to community member. Please share it with your member, with your family, with your peers. Increase that awareness about that using tobacco and cannabis to deal with mental health is worsen if you use in the long term. Please raise some campaigns, be advocate for integrated treatment for that. So that's why I'm so happy to share with everyone today. And I saw that people from all over the US and someone in Belgium too, right? In international, outside US. So make me feel like, oh, I'm go beyond become the researcher. I'm really become a community member to give it back to the community, to serve the community well. So please add in the chat any question, any needs, any information you need to do your work better. I will do research to serve your needs.
Wow. That's great. And so specifically, you again, you mentioned how do you have any other comments of how coalition members and substance use preventionists in the field can best use the findings from your research?
Yes, I think, as I mentioned briefly about the implication slide, right? First thing, we can do some campaigns, educational campaign or public campaigns. I'm happy to give it talk again to any coalition organization if you need. That's my pleasure and can make the impact in the community to like raise awareness of people, to correct the misperception about the benefits. Some people, they perceive the benefit from using substances to deal with the mental health. But again, it's a quick fix. It's not the real treatment to the mental health. So that's we need to correct that misperception among the general public. And also, we need to provide some training for healthcare provider, honestly, who do the prevention or intervention work, who treat the patient. Like, we need to integrate treatment for mental health and tobacco and cannabis cessation together. You cannot address tobacco alone. You cannot address cannabis cessation alone. You cannot address mental health alone. Because if you address one thing, the other thing will going on. And it's not really the comprehensive treatment package that will help people have the long-term abstain from substances and have the mental well-being.
Great. So now we'll move on to participant questions. We do have a few. We'll get to as many as we can. But please continue sending any questions that you have. So we'll start. So your data is pretty recent, but do you think 2024 data for computable cannabis would be different today with the explosion of liquid THC?
That's a great point. We try to replicate this study, but among adolescents who less than 18 years old. Our paper, my team who's working with me in the Hattie lab, just published in the JAMA Open Network about mental health and co-use of tobacco and cannabis among youth as adolescents. And we use a representative symbol from US youth from the past survey data, if you know about that. It's a tobacco survey annually. And we found the same result. Co-use linked to the higher odds of mental health among youth. So this paper was published last week, July 3rd. If you are interested, I can put in the slide at the end for you to read more about that, and you can use that for your campaigns or training of your organizations. But I believe that the issue will become more and more concerning, given all of the evolving of the product in the market right now. You can see that like tobacco, you can see the thousands of different desired product, the newer product, and cannabis also, right? The THC, they have the different combination between THC and CBD. They put flavor inside. They have the different design for vape, and also the fake product in the black market. So all of this really, not only mental health, right, but also other health issue too, respiratory. Like you may heard about the EVALI crisis in 2020, when young people vape the fake cannabis product in the black market, and their lung become like the popcorn lung, and a lot of hospitalizations. during that time. So yes, the issue will become more and more concerning, and we need to urgently to address this issue.
That was another question that also you answered, if you are doing studies with different age populations. So you mentioned adolescents. Do you have any plans for senior populations?
That's a great point. Yes, I would say yes. I'm expanding that kind of research right now into two, not only age group, younger adult, older adult. We have something going on in older adult right now. But honestly, the data on older adult is very small because it's harder to collect data from older adult when they report use or not. But we have a project going on right now. Hopefully, we can publish that soon. Another direction I would like to go into that, like I want to go to more the health disparity, like the race and ethnic group, because we figure out the more we do research in the different race group, we figure out about the cultural perspective so different. That can impact on the co-use of tobacco and cannabis, and also on the way they report and seeking the mental health treatment. Like stigma, they don't want to share about the mental health issue with other people. So yes, definitely we want to extend that in a more subpopulation who most vulnerable to this issue.
So there were actually a few questions asking if you considered or differentiated people who were using medical cannabis. Did you exclude that from the study, or did you, differentiate that within the population?
That's a great point. Unfortunately, in the paper I presented today, we didn't ask the question about the reason for use cannabis, and so that we couldn't like differentiate the medical reason or the recreational reason of use of cannabis. But I believe other pupils, other college doing that. But I'm not sure about whether they find anything different yet. It's another thing for future research.
Yes, yeah. And were cannabis edibles included in the cannabis use definition?
Great point. For the specific question in this paper among US adults, we didn't mention specifically about edible, but we mentioned like whether you use combustible, vaporized cannabis or other type cannabis. That's the language we asked. So we don't know how people perceive that in the question when they answer the question, the survey. But for the newly publication that we just published last week, we did ask specifically like you use combustible cannabis, vaporized cannabis, edible cannabis, and we include all of different type cannabis into the analysis. And I mentioned that we found a similar result.
Okay. We'll just have questions. One more question. Time for one more question. Please. Are there, do you know if there are other researchers pursuing this task? Is there interest in getting this information in front of legislators to help their decision making?
As far as I know, at least in my research network, yes, a lot of people interested about this topic because it's an emerging issue, right? Feel free to email me. I will put my email here at the slide presentation if you're interested in about, and if I can be helpful for your advocacy work, please feel free to reach out to me and I can gather other researcher to write up something. If you need to provide the current current evidence about co-use and mental health. So can give you the something for you to do the advocacy and for the support for the decision making. That's a great point and great work too. Please do so.
And there's one question just asking, how can we reach you?
Yeah, I will put my my email and in the slide. So I can put email here.
I can include it in the follow-up email as well.
Oh yeah, please.
Mhm.
Yeah, feel free
My email.
to reach out to me. Yes, I'm happy if I can serve your community and do other work to help with that.
Great. Okay, so there are a few more questions. I will try to save this and I can send it to you after. I know someone provided a resource for you. I will send that directly to you, Dr. Nguyen.
Yes, please. I see the chat a lot in the chat, and if you can save all of the comment in the chat, it will be helpful for me to read later because it's too many. I cannot read in the real time right now. But please give me any feedback about my presentations, any suggestions for the research, for the future research, what you need for your work, what you want to have for your advocacy work. That would be very helpful for me as a researcher and for us as the network to collaborate with each other to advance health equity and to promote the public health well-being for our society in general.
Yeah, and so please take a couple of minutes to complete an evaluation for this webinar. You can scan this QR code with your phone's camera or access the form by typing the link below that into your browser. We would love feedback on the topic, on Dr. Nguyen and the presentation. If you complete the evaluation, you can receive a letter of participation. You can download it from the thank you page at the end of the survey. You must fill out the survey to get the letter of participation, and you must download it right away because you will not be able to go to the page later. I will send a follow-up email to all attendees with this link so you can complete the evaluation at a later time as well. And please mark your calendars for the next Research into Action. It's scheduled for August 20th at 1 p.m. Eastern Standard Time. We'll discuss a research study on driving under the influence of alcohol, cannabis, and Delta-8 THC, the perceived likelihood, risk perceptions, and behaviors. And thank you, Dr. Nguyen, for sharing your time and all this great information for us. I'm excited to see how the coalition members and community partners will use this in their work. And if anyone in our audience has evaluation or research related questions, please reach out to CADCA's evaluation and research team at evaluation@cadca.org. And thank you always for your participation and continued support. So please remember to complete the evaluation and we'll see you next time. Thank you.
Thank you, everyone.